welcome to another episode of Coffee Talk with Encore. But before we begin diving into our Coffee Talk conversation for today, I would really like to wish all of the speech therapists listening in to have a wonderful speech and language therapy month. Well, today our discussion will be focused on the topic of LSVT loud therapy interventions. And this is a fantastic therapy intervention that's used by clinicians throughout the world, and it's used to help Parkinson's patients meet their individual goals. Well, in addition to all of that, today we are so pleased to have Ashley Richards joining us for today's Coffee Talk discussion. And not only is Ashley a speech pathologist, she is also a therapy program manager here at Encore Rehabilitation. So thank you to Ashley for being with us today. We are so glad that you're here.
Well, thank you for inviting me. I'm excited to talk about LSVT and how other speech therapists can really use this in their treatments and everyday life.
Well, welcome, Ashley. Can you just give us an overview of what LSVT loud is?
Yeah, so LSVT is a very specialized speech treatment for Parkinson's patients and other neurological diseases. Again, I need to state again that it's very specialized. It is a very regimented treatment. It works with a patient for 16 individual sessions. They're each an hour long. They're 4 days a week, 4 weeks. So it's very scheduled. Everything's laid out right for you, but it is a commitment.
I can see that. So can you give us some examples of, the positive impact that it has with the patients that you've worked with? And can you give us an idea of what type of patients would really benefit from this approach and how they can get in contact with an LSVT therapist?
I've seen huge results. Patients who have had old CVAs that are having trouble with speech, working with them, and now that their families can hear them on the phone is amazing. But that's just one of the groups of people that works with Parkinson's, multiple sclerosis, old CVAs, having speech issues, even so much as children with cerebral palsy and Down syndrome. This program, it can be adapted for them as well. Autism spectrum disorder, and even just typical aging as patients see that they're having issues.
So Ashley, I'm a physical therapist and I observe some speech therapy sessions on a pretty regular basis, but I can admit I'm not a speech therapist, right? But what's the difference in that typical treatment session for a big session versus your less formal, I'm just working on voice and volume?
The difference between those sessions is, like I said, it's very regimented. So you have an hour-long session. We get a day by day what we should be doing with the patient. It is individualized for the patient. So you pick phrases and stuff that they work with, but it is the same session almost every time you see them that first week. And then you change it up a little bit the next week, but it's the same session. The exercises don't change. The wording doesn't change. I mean, there's no variation. So your typical speech session with any other patient, I change mine up daily. And I never do the same thing every day with every patient. It's boring. This actually isn't boring because they start seeing results. They teach you how to model it. So you don't talk about it. You don't tell them how to do it. You model it. And then you just tell them, do it like I do it. And that's all you say. And that has been the hardest part as a speech therapist for me, because as you can tell, speech therapists like to talk and they like to explain things. They like to show you how. You can't do that here. You're just telling them, do it like I did it. And that's it. In 4 weeks, you see a huge difference in these patients.
Very interesting. So what about the therapy documentation aspect? So is there a certain way that you have to document and that you would recommend other therapists document when you're using the LSVT loud approach?
Yeah, there is a very certain way. They, like again, in the certificate, in the book they give us, you have a binder. It's just like being in college. You have another book you have. I mean, it gives you examples of how to talk about, we have to measure the loudness. We're measuring phonary effort, normal limits versus what they could do.
Well, Ashley, I do have a question for you. So I am an occupational therapist.
ma'am.
Is LSVT loud something that occupational therapists can also take part in and participating in that type of training? Or is it just specific to speech and language
The,
pathology?
the loud is just specific to speech and language pathologists. Now, they do have an LSVT big that is towards the OT and the PTs. I mean, it's a big difference in what we do as therapists. And theirs is more for you, and a PT would be more for the body movement. We're trying to help with that rigidity and that type of stuff, where I'm a speech therapist just working with just the voice and projecting and having them have a normal voice, or what to them is a normal voice.
Well, let's say I'm a speech pathologist then,
Mhm.
and I have interest in becoming LSVT loud certified. Tell me what that process looks like. What do I need to go? What are my first steps, and what could I anticipate with that?
It is, like I said, it's online. The certification is, once I got signed up, you sign a clinician practice and agreement. And once that's signed, you have 60 days to do the online training. If you sit down and buckle down and do it, you can have it done in a couple weeks, but it really does go at your own pace. You can get on when you need to. And I think I had it done in about 4 weeks, working full time and having a family. So, it is nice that it is paced that way. They give you everything you need. They send you everything electronically, and you have a book. So you can get started immediately. LSVT Global has a huge network online. Once you're certified, you're on a national registry. Any doctor that is seeing a Parkinson's patient and wants to look someone up to do treatment, they can go on here, we're registered, they can find anyone in their area. My name's on the area here in Virginia. And it's really great. They have great international contacts as well. I mean, they're working with people all over the world with this stuff. They have online groups for your patients once you're done with treatment that they can reach out to and continue and talk about their progress and what they're doing. And something I didn't mention before, LSVT with their treatments, with their research, they're seeing a good 6-month carryover. And as long as, if you can keep the patient in a maintenance, like just check up on them every 6 months, then it's a lifelong thing that they keep up with it. Their voice stays the same. So,
That's exciting. Just imagine, how that must feel for someone who previously couldn't really express themselves, who now can communicate with others and really have that dialogue that's so important for all of us,
yeah.
our relationships and being able to communicate with others being so important. So, well, thank you so much, Ashley Richards, for being here with us today and really sharing some of your experiences and what it's been like for you to participate in LSVT Loud, not only the training, but then utilizing that approach with your patients. It certainly looks like a fantastic type of therapy intervention to use and really creating some positive outcomes with your patients. So. Well,
really
thank you,
is.
Ashley, again. Thank you for being here. And thank you to everyone for listening in today. We look forward to having everyone tune in again for our next episode of Coffee Talk with Encore.